Hi, this is Dr. Derek, and today I'd like to talk with you about hip pain. Hip pain is a very common condition I see in my office, and when people come in with hip pain, a lot of times they'll point to their glute or to their side or even their groin, but what I'm talking about is this actual joint capsule itself. This is called the femoral acetabular joint, and it's often a site of pain. Why? Because people have a lot of hip problems. They're on their legs all day long, they're standing up, and they have a short leg, one leg's longer than the other. Maybe they had a fracture when they were younger and the bone didn't grow quite at the rate that it was supposed to. Maybe they have flat feet, they need orthotics, or they're wearing terrible shoes, or they have an old injury. A variety of reasons why people have hip pain. But I'm going to give you some tips here that you can use to help you if you have some hip pain. So first of all, you want to get your tennis ball, and I'm going to give you 3 areas to work with the tennis ball. 3 common areas that I find that have a lot of adhesions in them are the gluteus maximus, the tensor fascia lata, and then your psoas major and upper quad. So the first area you're going to work is just digging the tennis ball in the upper quad, upper glutes, right in there. You just kind of move it around, and you can do this standing or lying on the floor. The second area is right here on the side. Now be careful, there's not a lot of flesh here. It's more of a sheath, and so it's going to be a little tender, but you can just kind of move up and down to break up those adhesions. And then the third area is right here in the front. We're just going to kind of dig in here to the front, and you can kind of move up and down with that. Now, once you've done that, broken up those adhesions, I'm going to give you 2 stretches that you can do that are really great. So if you can get a table about this high, you're going to bring your leg up like this while you're standing, and you're just going to kind of stand here like this, and you kind of lean forward into it, and ooh, that's tight. I need to stretch this more. You can also push down a little bit, and I can really feel this stretch. I need to stretch this out more. I'm a little tight here. If you have a knee problem, be careful. You may not be able to do this stretch. So if you can't, I'm going to give you one more. This is a little easier. You're going to stand with your right leg like this, planted. You're going to cross your left leg over, and then you're going to put your hand like this, and you're going to lean up against the wall, and you'll feel the stretching. This is a much more forgiving stretch, more gentle and easier, and it feels really good. Really easy to do. Now, if you've done all that and you still have some hip discomfort, you may have some a more serious issue. Once you've been evaluated by your doctor, I think that's a great idea. But if you still can't find it, you may have some hidden adhesive scar tissue causing the pain. What I found fantastic to get rid of and phenomenal is using this energy pressure wave technology, where we'll dig right deep into the joint itself. But more importantly, the surrounding scar tissue in those areas, like I mentioned, like the gluteus maximus, especially these fibers, whoa, right up here, up into the groin area, and these muscles and through here, and then on the side, or then directly over the area of pain itself. The results are often phenomenal. So I hope this video has been helpful in helping you with your quest for better health and to get rid of some of this hip discomfort. And I hope you find it useful. At the end of this video, I'm going to show a testimony of somebody who was greatly helped with using the energy pressure wave technology, and I hope this has been helpful. This is Dr. Derek, signing off.
Okay, I've had this pain in my right side for the past 15-16 days. It got very severe in about 2 weeks ago, ended up in the hospital on heavy-duty medications. Nonetheless, still had the pain in my groin. Was released last week, still had the issues. Have seen a chiropractor for some adjustment to relieve the pain. It helped to some degree. So I'm here to get further treatment to get rid of the pain and cure the problem.
Okay, about a couple of months ago, I had a very intense pain. Ended up calling the ambulance, took me to the hospital, took me to emergency room, and they gave me 3 doses of morphine to try to control the pain. I stayed in the hospital. I had all different type of doctors, specialists look at me. I had 2 MRIs, 2 X-rays, and 1 CT scan taken. And physiotherapists and other specialist doctors, like I said, they looked at me and could not diagnose me. So they sent me home with a big bottle of morphine, and they said, you just need to be on pain medication, pain management, and see a pain management doctor because we cannot detect what's going on. So I heard about Dr. Taylor. We came here with by another player, a soccer player, that was telling me about his wife that was being treated by this chiropractor that uses all these sophisticated machine, and he's right on with what's going on and helping his wife tremendously. So I came and I saw Dr. Taylor, and I was very happy with what I saw and started the treatment and got results. Also, a few days ago, actually, I saw an old patient of mine, and because I wasn't going to work, I was out of work for about a month and a half because I just couldn't walk long distance, and I was in tremendous pain, so I couldn't really help my patients. So he was there, and he was telling me about his chiropractor that a couple of years ago helped him, and he was saying that his chiropractor was great. He was using all this great sophisticated machine, and he said it's probably better than yours, so I should see his chiropractor. So while we started talking, it ended up that his was in Torrance, and Dr. Taylor was in Torrance, and then he says mine is on Sky Park, and I said, well, mine is on Sky Park. So anyways, we found out that we're talking about exact same chiropractor, who is Dr. Taylor.
That's as good as you can walk right there?
Right.
Okay. Without pain?
Without,
If you try to walk more
still
normal...
pain, but I can manage to move around a little bit, but not long distance.
Okay.
This is short, only go to the bathroom or...
Right. What happens if you walk long distance?
Oh, it hurts, really. It gets up in 8, 9
Okay.
degree pain.
How's that feel?
I'm starting to
Yeah.
feel it a little, not painful, but feel it.
Okay.
But couldn't even walk 2 days ago, so,
Yeah.
so
Okay.
this is, it's pretty good. I couldn't walk on 2 feet, but now I can up on the painful one. So this is great.
All right.
It's great.
How's that feel? Okay. That feel good?
Oh, that feels great.